Welcome to the HR Chat Show, one of the world's most downloaded and shared podcasts designed for HR pros, talent execs, tech enthusiasts, and business leaders. For hundreds more episodes and what's new in the world of work, subscribe to the show, follow us on social media, and visit hrgazette.com.
Welcome to another episode of the HR Chat Show. I'm your host today, Bill Banham, and joining me on this episode is Dr. Alika Lafontaine, President at the Canadian Medical Association. Born and raised in Treaty 4 territory in southern Saskatchewan, Alika is an award-winning physician and first Indigenous doctor listed in the Medical Post's 50 Most Powerful Doctors. Hey Alika, welcome to the show today.
Thanks for having me.
It's an absolute honor to get you on the show. When I reached out to the awesome team over at Collision, and we'll be talking about Collision shortly, about the prospect of getting you on as a guest, and they came back to say, yes, I nearly fell out of my chair. So thank you very much for your time. Beyond my wee introduction there, why don't you start by introducing yourself to our audience?
Yeah, so Alika Lafontaine, I grew up in Regina, Saskatchewan, homeland of the Metis. I can trace my ancestry back to Red River. Political advocacy has been a big part of my family, but I was the first one in my family to actually go into the field of medicine. So I've had a lot of challenges and opportunities as a result of that choice. And in the past year, I've had the amazing opportunity to be president of the Canadian Medical Association and really be a part of the discussion of how to transform a system to make sure that the people that it serves better and the people that work in it can really thrive. And so it's great to have this conversation today.
Thanks for tuning in to the HR Chat podcast. If you're enjoying this episode, we'd really appreciate it if you could subscribe and leave a 5-star review on your podcast platform of choice. And now, back to the conversation.
Now, as part of my homework ahead of our call, I was trawling through your LinkedIn profile and looking at some of your recent posts. And in a recent post, you write the following: I was admitted to medical school through an affirmative action program. We need to change the conversation around affirmative action and meritocracy. The current narrative presumes applicants aren't qualified. We are, and sometimes we're very overqualified. Let's also be blunt about merit. It's subjective. It can be gamed. Meritocracy is whatever the person in charge thinks is valuable. And as statistics show, decision makers remain white and male. It's human nature, you say, to value what is familiar and devalue what is not. I wonder, could you now share more about your experiences and why you believe we need to change the narrative around affirmative action and meritocracy?
I think to the general Canadian, it feels like a lot of systems are broken right now, right? And the reason why I start off the answer to the question that way is that the whole point of intervening in systems, whether it's who gets trained to then provide the services, how they provide services, how we measure outcomes, distribute funding, build infrastructure, all that really depends on whether or not the system is achieving its desired outcome. And so I think when I was writing that, it was in response to the SCOTUS decision down south about affirmative action and its role in admitting folks to higher education. And the reason why representation in different systems is so important is I really think these systems, they aren't serving the people well. We wouldn't actually have this discussion about affirmative action if things like healthcare actually provided good access, both now and historically, to persons who don't live in big cities, who come from high socioeconomic backgrounds, who are non-racialized. These are all the layers that we hear over and over again of people who are, disadvantaged or have worse health outcomes. But the truth is, it's really because we design systems this way. If you look at the way that healthcare has been built across the country, for example, you don't actually see much health infrastructure at all on reserve. And then people wonder, why is there such health outcomes for folks who live on reserve. We here in Grand Prairie, where I live and work, we're in the middle of the forest fires that happened, earlier in the summer and the late spring. And one of the statistics that I came across was, if you're on reserve, you're have an 80x chance of having your house burned down. People, if you interrogate the number, you'll realize the reason why is there's no fire departments, like there's no fire infrastructure if things start to burn. And so, going back to affirmative action, it's really important to recognize that the reasons why these programs exist is because the services aren't actually achieving the outcomes for the people that they're supposed to. And I would say that in my own journey through healthcare, it's clear that these programs still struggle to recruit folks. When I got into medicine at the University of Saskatchewan, I applied with a GPA that was like a 4.0. I had a good MCAT score, which is the medical college admissions test. I had papers under my name. I had done a ton of research, obviously a ton of volunteer work, and had won different awards. I was a pretty good candidate on paper, but I just never would have considered becoming a part of that system, because not only did it not serve the people that I loved and cared about and grew up around, I didn't see myself as part of that system because there was no one else like me there. And in the first year of medical school, I actually was the only Indigenous applicant.
Let's now talk a little bit about Collision, the recent Collision conference in Toronto. There you were part of a panel discussion on Indigenous data sovereignty. Can you tell us a bit more about the discussion?
So the discussion really centered around the importance of having people at the table when it comes to data and the value that comes out of that data, a part of the discussion. I think we've gone through a series of realizations with these services that we know are free. I mean, it's very common for the average Canadian now to recognize that if a service is free, you're probably the product. Do you know what I mean? So having folks recognize that, and then also be placed in a position where they can start to define that sort of value, I think is really, really important. We also got into discussions around infrastructure, the need to make sure that people can participate in the digital economy. You need infrastructure in place to do that, including things like broadband. And then we talked a bit about skills development and the need to ensure that folks from communities that want to be engaged actually are a part of the economy. Not only people that provide it, but also build these businesses and do this training, etc. And so it was a pretty broad ranging conversation, but at the end of the day, it recognizes that with this digital transformation that the world is going through, if we don't focus on supporting Indigenous communities and nations and being a part of that, we will widen those disparities that exist already economically, health-wise, and in many, many other fields.
In the fast-changing new world of work, organizations that want to succeed must support their teams to develop the right skills for today and for the future. As practical learning experts, Holt EF Corporate Education helps organizations and employees of all levels to develop the critical business skills, attitudes, and behaviors they need to be successful. We combine the expertise and agility of a boutique learning partner with the resources of a trusted, global organization. Learn more at holtef.com.
So maybe you could talk a little bit more about how acute those disparities are at the moment, particularly in the healthcare field. Can you talk to that?
So we do know that Indigenous communities lag behind with a lot of the indicators that we look at, things like chronic diseases, like diabetes, heart disease, among other things. We know that when it comes to acute harm that happens, so if you have a stroke or you have a heart attack, that people tend to be further away from healthcare, and with that farther distance and that lack of access, people often have worse health outcomes. We also know that Indigenous peoples generally have a much more likely chance of having negative experiences, not only in the way that they interact, but also whether or not they're given the same sorts of options as other folks. And when they choose those options, that they get the same sort of support. And so I think when it comes to healthcare in general, when it comes to Indigenous peoples, the disparities are not only stark, but they're also broadly applied across all the different types of ways that you could measure.
Let's switch topics now. You were in Winnipeg recently, July 10th through to 12th, for the Premier's Council of the Federation meetings. Prior to these meetings, the CMA issued a series of recommendations for premiers to consider. Can you tell us about some of those recommendations now?
There's been a ongoing conversation about the crisis in healthcare, and the average person who accesses healthcare nowadays, I think, has a fairly negative experience. I just spoke about Indigenous patient experiences. I think a lot of folks are actually experiencing what Indigenous peoples have experienced for many, many years. And in leading up to this conversation, there's been a shift in what we've been focusing on as far as messaging. First focusing on making sure that people recognize that not only this crisis needs to be acknowledged, but it's not the same sort of crisis as what's happened in the past. Advocating for resources to be set aside, that did happen in the last federal budget. And then now focused on making sure that people collaborate and coordinate with each other as we solve these big problems that we're all kind of trapped in together. And I think coming out of the meeting, one of the things that I've become very optimistic about as a result of the discussions is that, premiers do get that we have this crisis and they can't fix it alone. We've had previous cycles of positive change in healthcare. I know it's hard to think about that in the midst of going to an emergency room and waiting 18 hours, or not being one of those more than 6 million Canadians who don't have access to a primary care provider. But in the past, when we've had good investments, like back in 2004, it was the second largest investment in healthcare by the federal government at that point. Um, we did see people start to come together and start to collaborate. We had the First Ministers Accord that came out in 2007. We had the Wait Times Alliance. Between that time and around 2011, 2012, it really felt to a lot of us that things were actually getting better. But then people kind of got up and just left the table. They started to be competitive again and non-collaborative. People started to create their own siloed solutions, and we had almost a decade where we were focused on the wrong things, and we didn't work together. And so I think the optimism really takes its root in having the words and the focus on things like collaboration and coordination, because that's the only way that we're going to get out of this crisis.
Okay, so are you satisfied that the premiers are working to improve the health systems across the country in a meaningful way? You've said lots of nice things, but do you think there's actually going to be movement happening?
Yeah, I think there's a big difference between optimism and satisfaction. So I'll be satisfied when the problems are solved. When I talk to, uh, just the average patient across the country, and they tell me, I'm satisfied with the amount of time that it takes me to be seen and emerge. I can get access to a family doc. I don't have to spend days and days trying to go through multiple different doors to try and find the care that I need for myself or a loved one. I think at that point, that's when you become satisfied. Now that is way off into the future. I think one of the realities of how severe the crisis is that it's going to take months to years to actually solve a lot of these problems, and it's going to require much more than just words. But I will tell you that the optimism, though, in hearing premiers make public statements, and to be clear, they haven't made these kinds of statements in the past. That this is a pivot. Even having the presence of healthcare integrated into other things. The statement that came out after the council meeting was focused on things like infrastructure, but a recognition that with that infrastructure, healthcare has to be a part of not only the planning around energy corridors, but also how are we going to manage patient access across the country as well. I think for that, I can be optimistic, but I'm definitely not satisfied until the problem's actually solved.
We're about to wrap up. Before we do, how can our listeners connect with you? Is that through LinkedIn? Do you want to share your email? Anything else there? And anything else they should know?
Yeah, absolutely. So if folks would like to learn more about the Canadian Medical Association, they can go to cma.ca. and contact our organization through there. If you want to connect individually with me, I have a LinkedIn, just Alika MD. If you want to check me out on Twitter, that's where I tend to have most of my one-to-one communication, although I am like hundreds of millions of other users trying out threads, so my username there is Alika MD as well. But I think that being a part of the conversation is incredibly important. And if you're looking at the reasons behind why things are changing, it's because patients are speaking up, talking about their experiences, and providers are speaking up, talking about their experiences. And that's the root of all the change that we need. And, that really needs to be the focus for folks like myself and other leaders across advocacy organizations, really supporting the people who are doing the work and experiencing the harm in getting their voices heard by people who can do something about it, like our premiers.
And before we wrap up, if there's anything else that we at the HR Gazette can do to help spread the word, by all means, please do put your team in contact. So much respect for you and your team. That just leaves me to say for today, Dr. Alika Lafontaine, thank you very much for being my guest.
Thanks for having me.
And listeners, as always, until next time, happy working.
Thanks for listening to the HR Chat Show. If you enjoyed this episode, why not subscribe and listen to some of the hundreds of episodes published by HR Gazette? And remember, for what's new in the world of work, subscribe to the show, follow us on social media, and visit hrgazette.com.